Well, welcome to Stroke, the Junior Plan podcast. My name is Aaron Al. I got a really exciting World Stroke Day special event today. I got a nurse stroke navigator from Southern California. His name is Justin. I can't wait for you to meet him. But but mainly is here. It's World Stroke Day. We want to make sure. Please, everybody, watch the video, share the video. Be part of raising stroke awareness worldwide. So let me bring on Justin and say hello to him and have him introduce himself. Let me bring him on. How you doing, Justin?
Hey, how's it going, Aaron?
Great to meet you, bro. Introduce yourself.
Hi, everyone. My name is Justin Vechayiem. I am a registered nurse at Hoag Hospital. I am a stroke nurse navigator here, and we do a lot of education, support, and provide resources for patients all the way from the acute phase experiencing a stroke out towards the outpatient and beyond. We do a lot of education for the staff here, the doctors, the nurses, ancillary staff. We also hold stroke support groups that are totally free, both virtually and in person, and anybody is welcome to join those. We also do a lot of follow-up out following a patient's stroke, calling them, making sure everything's going okay with them, that they're recovering, addressing any issues they might have, talking about their medications and follow-up appointments, and any speech therapy, physical therapy, occupational therapy needs they might have, and helping them kind of navigate the healthcare system, trying to connect them to the right people as they need. We also do a lot of community events. Recently, we did an event at the OC Soccer Club, raising a lot of stroke awareness, providing a lot of education there to both adults and children. There was about 3,900 attendees there, and we got a lot of touch points there, and were able to talk to lots of folks. So a lot of community education, community outreach, do a lot of presentations at senior centers as well within the surrounding communities. So it's really all about, raising awareness, providing education, and preventing strokes. But if you do have a stroke, we can help you get through it, and we'll stand by you and walk beside you through the whole thing. So happy to be here, Aaron. Thank you for having me.
Yeah, it's my honor, Justin. I told you, I think nurses are the backbone of stroke survivors. But the one that Ross, can you see Ross Bentley? She is from Australia. So,
Oh,
Ross, thank you, man. I appreciate it. And then you have today for us a PowerPoint presentation. And I'm going
yes,
to let you get right into that. Justin, let's get right into that right now.
sure.
All right, let's go for it.
All right.
Let me pull that.
Okay, folks. So this is a presentation that I give at a lot of local community centers. Like I said earlier, it's really to raise awareness what strokes are, the different types of strokes, the different types of treatments that are available, how to recognize the signs and symptoms, what to do, and also recovery and stroke prevention. So, like I introduced myself earlier, my name is Justin. I'm a RN, BSN, SCRN. My previous experience was in business management, and I decided to make a shift to nursing when my father got sick. I really wanted to help people, and that was kind of the trigger point that caused that change. Um, so now I'm a stroke nurse navigator after being at my hospital for about 17 years, and this is my specialty now. So today's class, we're going to help you understand what a stroke is, know the different types of strokes, correctly recognize stroke symptoms, know what to do if someone has stroke symptoms, learn about stroke treatments and stroke recovery, and understand stroke risk factors and stroke prevention. So, what is a stroke? A stroke is a brain attack, essentially. It's an injury or damage to the brain. It's caused when a blood vessel to the brain becomes blocked or bursts, cutting off blood flow, oxygen, and nutrients to an area of the brain. Now, there's two different kinds of strokes. There's an ischemic stroke and there's a hemorrhagic stroke. An ischemic stroke is the typical kind of stroke that you think of when somebody has a stroke, and it's caused by an embolus or a thrombus, or also known as a clot, that blocks off a portion of the arteries, the vessels in your brain, which causes the cutoff of blood flow and oxygen and nutrients and tissue damage. Hemorrhagic stroke is also a stroke, but operates in a different way. It's when a blood vessel or an aneurysm bursts and causes bleeding, which then leaks into the surrounding tissue, causing irritation, inflammation, edema, swelling, things like that. Both of those interferences with proper blood flow to the brain causes those stroke-like symptoms that you guys may be familiar with. So this is kind of what happens. Brain cells need a constant supply of oxygen and nutrients, such as glucose. When the brain cells don't function, neither do the parts of the body that are controlled by those brain cells. Depending on the location of the stroke in the brain, that's going to determine which body functions are affected. So up here we have a couple of images. Uh, the image on the left side of your screen is kind of showing the different arteries that feed your brain. You can see the internal carotid arteries and the vertebral arteries coming up through the neck and then branching off into different major arteries that feed the different areas of the brain. On the right hand side, excuse me, you'll see an image that kind of denotes what areas of the brain are responsible for those kinds of different functions, body functions. So you could imagine if there was a blood clot, perhaps here in the middle cerebral artery. If you look at the image on the right, that's kind of near the temporal area, the motor strip. So depending on which side of the brain, that could affect your hands, your coordination, your movement, your ability to grab things, your legs, your trunk, things like that. If it was located perhaps maybe in the posterior cerebral artery, the PCA, that could impact your vision. As you can see on the right, the image on the right, the back of the brain there is responsible for the vision. So really depending on where the clot or the bleed occurs, that's where you would experience those types of symptoms. So here's some statistics, kind of scary statistics. About 795,000 strokes occur each year in the US, and stroke is the fifth leading cause of death in the US. It's probably now back up to the fourth leading cause. For a while there, COVID was the fourth leading cause, but I think they kind of switched. We are seeing an increase in strokes because of the clotting issues that arose from COVID. So it's probably back up fourth place. Every 3.25 minutes, someone dies from a stroke in the US, and it is the number one cause of adult disability in the US. And it's very, very, very expensive to take care of strokes. You know, there's a lot of acute treatment, rehabilitation, caregivers, things like that. It's just a very, very expensive disease process, very debilitating. So we need to really try to prevent these strokes from happening. So I'm sure you guys are familiar with BFAST. That's the acronym on how to recognize stroke symptoms as quickly as possible. The B stands for balance. So if anybody or yourself experiences a sudden loss of balance or coordination, have a sudden trouble walking or dizziness, that could be a sign. E is for eyes. If you experience a sudden loss of vision, blurry vision, double vision, or a field cut, it's usually one-sided, left or right, uh, one quarter, but on the same side through both eyes, that could be a sign. If you experience sudden facial drooping or numbness or weakness on one side of your face, that's usually when we ask someone to smile. We can really see that deficit, and that could be a very big sign. It's easy to check that one yourself as well in the mirror if you ever feel something's off. Um, A is for arm. That's for sudden arm numbness or weakness or tingling or loss of use of that side of the body. It can be both your leg and your arm, or it could be just your leg or just your arm. It depends on where the stroke is located in the brain again. That's a big sign. And S is for speech, that a person could experience sudden confusion, difficulty speaking, getting the words out, understanding what's being said to them, or they could have slurred speech, things like that. That's a big sign. And then the most important part of this BFAST acronym is T, which is for time. You have to call 911 right away if you experience any of these symptoms because you have about 4.5 hours from the time that you were last seen normal to receive medication that could potentially reverse that clot, that stroke, and potentially save your life and reduce your risk of developing permanent deficits. So it's very, very important to call 911. Don't try to drive to the hospital. God forbid, you have some deficits that you're not aware of and you could crash into someone, take yourself out, take someone else out as well. Um, the other caveat of that is there are only certain hospitals that are able to provide these treatments and they're certified stroke centers. If you call 911, they will do assessments in the field that will kind of indicate that there is a likely chance that you are having a stroke, and they will pre-notify the correct receiving hospital, and the team will be ready to go to receive you as quickly as possible and get you all the life-saving treatment performed within 20 minutes. So it's very, very important to call 911. Don't drive yourself. Don't have your family drive you. Um, this is another version of that Be Fast. This is some more kid-friendly stuff that we did. So that we can raise awareness for children, teenagers, things like that, because a lot of times they're around their parents, their grandparents, their uncles and aunts, their family, seniors in the community, and they're the only ones there. So they could also potentially save someone's life. So we kind of talked about this, what to do when you recognize a stroke. Call 911 for any stroke symptoms. Don't go to sleep, take a nap, brush it off, rub dirt in it. Don't do any of that. You really need to take it serious because it could potentially be very, very disabling for you and potentially life-threatening. So really call 911. Very, 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 very important. And this goes for anywhere in the nation, anywhere in the country. The emergency medical systems are set up in a way to where when you call 911, they're going to take you to the nearest receiving center. That way you get the treatment as fast as possible because every minute that the brain goes without blood flow and oxygen, about 2 million brain cells die. So it's really important to get the treatment as fast as possible. This is the stroke chain of survival. First, we need to recognize the symptoms and activate EMS, which is the medical emergency system. We have timely EMS response. Then you're transported in to the stroke center, and the stroke center is pre-notified. There you receive guideline-based stroke care, and then also quality post-stroke care is a big component of it, whether that be um, in an acute rehab in the hospital or another area, um, home health with therapies, outpatient therapy, all the different therapies. So it goes all the way from the beginning to the end. Very important. So this is important here when emergency medical services arrive. It's important to tell them when you last saw the person normal without symptoms. So that would be like what their total baseline is, what they're normally like. We need to know that time because that's going to dictate whether or not they're able to receive this medication. Some important questions to think about are, did you witness the event? Were the symptoms that they experienced? Did they wake up with these symptoms? Sometimes patients will go to sleep at nighttime totally normal, and they'll wake up in the morning with these symptoms. That's what we call a wake up stroke. And unfortunately, in those cases, you cannot receive the clot busting medication called TNK because you're outside of that 4.5 hour window. Your risk for bleeding then increases. So the cost benefit is kind of out of whack there. So we don't do that unless in special cases, but there is something called a mechanical thrombectomy that can be performed within 24 hours of last time seen normal. So that's still an option. Um, and then again, were they normal before going to bed last night? What time did you last see them normal? Time is the key factor there. It's also important to let them know what kind of medications the person is taking. It would be very important to know if they're on blood thinners, such as like Eliquis, Pradaxa, Xarelto, Coumadin, those kinds of things, because that will probably automatically disqualify them to receive TNK, because you're essentially giving someone something that's breaking up clots further and giving them a higher propensity to bleed. So that's really important to know. Also, blood pressure and heart rate control medications. Those are important to know because the body has an autonomic response when it has a stroke. It wants to pump up its blood pressure to increase the perfusion to the surrounding viable tissue in the brain. It may be used to a certain level of medication if a person is on blood pressure medication. So it's important to know those things because we need to get that blood pressure controlled in order to give you that medication and prevent further damage. Also, antithrombotics of any kind. It would also be good to know if they're on aspirin, Plavix, things like that. Um, so those are really important different medications. Make sure you give them your cell phone number or the phone number of a family member. That way the doctors can speak to that person so they can understand what the patient's baseline is if the patient is unable to speak for themselves. Because a lot of times, as you guys know, there's expressive aphasia that's a big symptom, and some dysarthria may be difficult for healthcare practitioners to figure out what's going on. Um, do not give the person an aspirin. Do you guys know why? So, for a long time there, there was a lot of education and information pushed out about heart attacks. Said, if you're experiencing a heart attack, take an aspirin. It could prevent, a full-blown heart attack. Or when you come to the hospital, part of the protocol for treating a myocardial infarction is aspirin. Um, but they're different things. That's a heart attack. This is a brain attack. In a brain attack, it could be two types of strokes. It could be an ischemic stroke, where an aspirin would probably help, or it could be a hemorrhagic stroke, which is a bleeding type stroke. If you give an aspirin, it's going to increase their bleeding, which will worsen their stroke. The reason why you don't want to give that out in the field is because we don't know until we get a CT scan if it's a bleed or not. So imagine giving them an aspirin and they bleed out in the field, at home, wherever, um, because you didn't know. Now that patient is going to suffer worse outcomes. So do not give an aspirin. That's only for heart attack. So here are some images of what a stroke looks like on a CT scan. On the left over there, the purple colored spots there, these are slices of a CT scan. That's what's called a core infarct, and that's where the main stroke happened. Then on the right side, you'll see the green area, and it looks really, really big. And that's a good thing. This is the salvageable brain tissue. This is the salvageable penumbra that surrounds that core infarct that we can save if we can knock that clot out that's causing that damage. So it really shows if we can treat these clots as soon as possible, then we could salvage a huge amount of brain. Because if you imagine all of this area was impacted, that's going to cause a significant amount of disability. So we really need to treat these as soon as possible. And then here we have the ischemic stroke treatment options. So the ischemic stroke happens in about 87% of all cases. The treatment is TNK. It's called tenecteplase, TNK for short. It is a clot-busting medication. Previously, the medication was TPA. This is a new, updated, and improved medication that we're able to deliver more quickly. It doesn't take as much time to flow in. So it's a really, really big advance in stroke treatment for clots. It's given through the IV, and it can be given up to 4.5 hours from the last time seen normal. The other treatment for an ischemic stroke is what I mentioned earlier, mechanical thrombectomy. It's a minimally invasive procedure that uses a catheter introduced through the groin or wrist under angiography. So you would go to an interventional radiology suite, and an interventional radiologist would perform this procedure, and they're able to put a catheter from your groin or your wrist all the way up to your brain and potentially pull that clot out with a stent retriever or a suction type device like a little vacuum and restore the blood flow there. Um, both can be performed. You can receive both TNK and do a mechanical thrombectomy if you have a large vessel occlusion. Um, but it is nice to have that backup option for the mechanical thrombectomy if you qualify but did not get to the hospital in time. So here are the hemorrhagic stroke treatment options. Oftentimes patients will describe what's called a thunderclap headache, or the worst headache of their life. It'll feel like your head's going to explode or rip apart. The patient might have neck stiffness from the blood accumulating in the brain, all the pressure. May experience nausea and vomiting, have photosensitivity, which means they'll be very sensitive to light. They'll be very photosensitive to sound, and it can persist for hours and hours on end. It's just like the most severe headache of your life, and this is the biggest sign that you may be having a hemorrhagic stroke. It's different from a migraine. It's going to feel very, very intense, extreme, um, extremely painful. Thankfully, this only happens in about 13% of strokes, and it's split into two kinds of hemorrhagic strokes. So one is a subarachnoid hemorrhage. That's where the bleeding goes into the subarachnoid space surrounding the brain and causes irritation, pressure, inflammation, things like that. Nowadays, there are a lot of treatments that are available to treat subarachnoid hemorrhages that are usually caused by aneurysms, and that's done through interventional radiology, similar to the mechanical thrombectomy, where they're able to go in with a catheter and do a coiling and essentially block off that ruptured aneurysm. Or they can do stenting, which controls that area as well. Uh, a little bit of an antiquated procedure is through neurosurgery, where they're able to do a clipping, but that requires open surgery of the brain. The other type of bleeding type stroke is an ICH, or an intracerebral hemorrhage. The most important component of this is blood pressure control, because the blood is just leaking into the surrounding brain tissue, causing damage. And if your blood pressure is high, it's going to bleed even more. So the main thing to do is get that blood pressure down. This requires a lot of close neurological observation, potential neurosurgery like a craniotomy or craniectomy, and even possibly placement of an external ventricular drain to drain excess blood and cerebral spinal fluid out of the ventricles of the brain to reduce pressure. Here are a couple of pictures kind of depicting the difference between a subarachnoid hemorrhage and an intracerebral hemorrhage. On the left, you see a subarachnoid hemorrhage, all that red surrounding the brain tissue. That's blood filling the subarachnoid space, causing a lot of irritation and inflammation, usually caused by a burst aneurysm. You can kind of see that little balloon-shaped thing on the artery there. And down below that, you can see some of the treatment devices. On the left, you can see a bunch of what looks like coils or strings. They're a metallic coil that's packed into that aneurysm, and that essentially kills that aneurysm off, allows the blood flow to be restored in a normal way. Um, and that is considered a secured aneurysm that is no longer under threat of bleeding. Then there's a flow diverter, which is kind of like a stent that pushes the blood flow around or away from the aneurysm. And then neurosurgically, they can apply a clip, but again, that requires open brain surgery. On the right-hand side, we have the intracerebral hemorrhage, and that's where there's a weakened small vasculature blood vessels that can leak due to hypertension, uncontrolled hypertension. The blood comes out, causes a lot of irritation, inflammation, presses on the brain tissue, can compress the ventricles, causing a lot of damage and a lot of symptomology. Down below that, you can see where they can evacuate the bleeding. And the way they do that is they drill a hole, they can insert a catheter, suction out some of that blood, and then the brain is allowed to reform and go back to its original shape. So important things for ischemic stroke treatment. The last time seen normal or last known well must be established. 0 to 4.5 hours, the patient can receive that clot-busting medication, TNK, like we discussed, and then 0 to 24 hours, they can potentially have the mechanical thrombectomy if they have a large vessel occlusion, which is one of the main arteries that are in the brain, feeding the brain. This is just some pictures of the medication going in via IV, picture of a clot on the bottom left-hand corner. It's made of red blood cells, thrombin, cholesterol, platelets, glucose. So all of those things can kind of get stuck together and form a clot and then get lodged in a blood vessel. So here's kind of an image of what's going on in a mechanical thrombectomy. They push the catheter up into the brain, and it has a stent retriever which they can deploy around the clot, and then they withdraw that catheter and retrieve that clot. That then restores full blood flow to the brain. And you can kind of see a little image on the right-hand side of what the clot looks like when it's captured in the stent retriever. This is a picture of our IR suite, the interventional radiology suite with one of our doctors and nurses, and a picture of a clot that was pulled out from somebody's brain on the bottom left, actual clot. And then on the right-hand side, you can see the images before the thrombectomy, where the arrow is pointing. That's where the clot is. And you can see up on the top upper left area here that there's no blood flow there. And then after the thrombectomy, where the arrow's pointing, they've pulled that clot out, and you can see all the vessels being refed by the blood and the oxygen, all the blood flow. So that's blood flow restored and potentially a life saved. Here's the vacuum style mechanical thrombectomy device, the catheter. It can just suck it out if it's loose enough. And that's just the vacuum device. So recovery after a stroke is achieved through stroke rehabilitation. It starts within 24 hours of admission to the hospital. and it could be ongoing for years after a stroke, usually lifetime, because there's always room to improve, to get better. The brain is very neuroplastic, has a lot of adaptability, and it can learn new things. So never give up if you have suffered a stroke. Keep moving, keep working on it. You can work with physical therapy. They really help improve strength, coordination, balance, and mobility. Occupational therapy, so they'll help with activities of daily living like bathing, dressing, cooking, brushing your teeth, brushing your hair, writing, etc. Using keyboards, all the things that you would need to do for your daily routine, daily activities of living. You can also work with speech therapy. They can really help a lot, not just for speech, improving the quality and the pace of speaking, but also swallowing, because stroke patients often suffer from dysphagia, and that can be impaired. They also work with cognition. So some folks will experience cognitive deficits following a stroke, and they can really help in those areas. So don't give up if you have had a stroke. There's lots of folks that can help you out there. The stroke recovery team involves lots of people. You have your primary care doctor, your neurologist, maybe a neuropsychologist that can help with post-stroke depression, maybe a neuro-ophthalmologist or neuro-optometrist if you're having visual deficits. They can help with that. You may need driving assessments and training so that you can drive again. A lot of times, physicians are mandated reporters for stroke because, as you can imagine, depending on what your deficit is, it could make it unsafe for you to drive. But there are classes out there, adaptive classes as well, where you can really learn how to drive again according to whatever disabilities you might have now. A big team member will be a cardiologist because a lot of the brain health also crosses over to heart health, and they'll need to communicate closely with your neurologist to make sure that you're on the right medications and your blood pressure is in the right area so that we can optimize your recovery and prevent strokes, future strokes. You may need to see a vascular surgeon depending on if you have carotid artery stenosis or atherosclerosis. They can help address that. Or if you have DVTs, they could potentially do vascular bypasses and things like that if they're significant enough. And then we also have different support groups. We have two support groups at our hospital. They're both hybrid, in person and via Zoom. For those that can't drive or the timing is inconvenient, we encourage anybody to join us. They don't have to be patients from our hospital. They could be from anywhere in the country. We do have some folks that join via Zoom from New York. One lovely lady is from Hawaii. I've had someone from Australia come before, so it's really good stroke support group availability and good groups that help each other. So the best kind of stroke is one that doesn't happen, right? So stroke prevention is the key. So we need to know your risk factors, and we need to make lifestyle changes to reduce those risk factors. 80% of strokes are preventable. So there are two types of risk factors. There's non-modifiable and modifiable. The non-modifiable risk factors are age, gender, well, really sex, and ethnicity, as well as personal or family history. The modifiable risks are hypertension, hyperlipidemia, atrial fibrillation, diabetes, sleep apnea, whether it be obstructive sleep apnea or central sleep apnea, smoking, alcohol or drug abuse, obesity, stress, and sedentary lifestyle. So these risk factors that you cannot control. Risk of stroke nearly doubles every 10 years after the age of 55. Everybody thinks that a stroke is a disease that only impacts the elderly. It doesn't. It can happen to small children, teenagers, young adults, anybody. It can happen to anybody. But as we do get older, a lot of our body changes, our vasculature kind of gets a little bit tighter, maybe more narrow. Um, our bodies don't process things as quickly or as effectively, so we do become more prone to strokes. Stroke is more common in the elderly, of course, but many people under the age of 65 do have strokes. And like we said, anybody can have a stroke, even children. You can't change your age. We don't have time machines yet. I don't even think a time machine would change your age. It would just bring you back in time. Um, and we haven't found the fountain of youth, but whoever finds it will be the world's most popular person. Family history. You can't change your family history. If your parents or your grandparents or your siblings have had a stroke, especially before the age of 65, that's probably going to put you at greater risk for stroke. The other thing to consider about that is you may not necessarily be at higher risk for stroke because your family members have had a stroke. It may have just been a difference in culture or healthcare access or um, economics. It could just be lifestyle. It doesn't necessarily mean that they had hypertension because they had genetic hypertension. Maybe they had a poor diet, didn't exercise, things like that. So it really kind of depends. Ethnicity, we can't change our ethnicity. African Americans have a much higher risk of death from a stroke, and Hispanics and Latinos are also at increased risk for stroke. Unfortunately, females are at a much greater risk for stroke, and I always say the reason why you guys are at higher risk for stroke is because we cause you a lot of headaches. So, kind of unfortunate. But men are at higher risk for heart attack, and that's because you guys break our hearts. So, some of the risk factors you cannot control: gender, um, probably should change that to sex. Women have more strokes than men each year. More women die from the effects of stroke than men. Factors that increase risk of stroke in women are pregnancy, history of preeclampsia, oral contraceptive use, postmenopausal hormone therapy, and migraines with aura. So a lot of women are on oral contraceptives. Those kind of mess with hormone balance, and that hormone change can make them more predisposed to clot formation. Same kind of thing with postmenopause. Kind of hormones are changing, body is changing, so they can be a little bit more prone to strokes. So twice as many women die from stroke, about 85,000, compared to those that die from breast cancer, which is 42,000. I think a big thing with that is that our screening for breast cancer has improved and treatments for cancer in general have improved. So in the US, 1 in 5 women will have a stroke. About 55,000 more women than men have a stroke each year. Stroke is the number 3 cause of death in women, and it kills over 90,000 women per year. Among women, black women have the highest prevalence of stroke. Prior stroke, TIA, or heart attack can raise your risk as well. Sorry, the photo there is cutting off the words. A person who has had a stroke has a much higher risk of having another stroke than a person who has never had one. If you've had a prior heart attack, that also increases your risk of having a stroke. Since a heart attack is caused by plaque buildup and blockages in the blood vessels of the heart, it's very similar to a stroke. Like I said earlier, brain health and heart health kind of mimic each other. The same kind of thing can happen in the brain, causing blood vessels to stiffen, to narrow, and to be more prone to clotting, causing a brain attack. Then there's also a TIA, transient ischemic attack, sometimes called a mini stroke. It's kind of a warning sign of a future stroke. TIAs are smaller temporary blockages in the brain that produce stroke-like symptoms but don't leave permanent damage, and they can't be picked up on a scan, like on a CT scan or an MRI. So essentially, a clot got to that area of the brain, stopped some of the blood flow for a little bit, usually resolves within a few minutes or hours, and then it passes through or is reabsorbed. So the symptoms aren't permanent. But it is still important to seek immediate medical attention because you never know if that TIA is going to actually be a stroke, an ischemic stroke, or turn into that or evolve into that. And even if it is just a TIA, you can still get all of the stroke treatment, the stroke workup, and we can optimize you so that you do not have a full-blown stroke. So TIA, stroke, anything, call 911. So these are the risk factors that you can control to treat and improve and prevent a stroke. High blood pressure. High blood pressure is the number one leading cause of stroke in the world. It's the number one risk factor. So it's important to manage your blood pressure. When it stays in healthy ranges, you reduce the strain on your heart, your arteries, your kidneys, your lungs, everything, your whole body, and it reduces your risk of stroke. The normal blood pressure nowadays is still 120 over 180. They do loosen that a little bit as we get older. A more realistic blood pressure in adulthood is usually somewhere between 1 teens to 130s, around 70, below 70s to 90s diastolically. That tends to be a more realistic number. For stroke prevention, we want your blood pressure below 140 over 90. Here's kind of a graphic that's showing the different levels of blood pressure. Normal is less than 120 and 80. Elevated is 120 to 129 over 80. Hypertension stage 1 is 130 to 140 or 80 to 89. High blood pressure or hypertension stage 2 is 140 or higher. So 140 over 90 or higher. Um, and hypertensive crisis would be higher than 180. That's, you need to seek immediate medical attention. I've done several community events where we have done blood pressure screenings and stroke risk assessments, and I have taken a patient's blood pressure and it's been 210 over 105, and I've had to send them to the ER, and they had no idea their blood pressure was that high. They don't normally check their blood pressure. So it's really important that you at least get your blood pressure checked once a year with your doctor. And if you do have high blood pressure, you should monitor it every single day. Very important to keep track of it and change the things that you can. So diabetes is a very big risk factor. Some of my slide is missing here. I don't know why. Um, But diabetes is a big risk factor because of the damage that it can cause to your vasculature. Also, the glucose molecules that are in higher abundance fill up your vasculature as well and can combine with all the different components of clots to cause clot formation to increase. Diabetes is like the number 3 risk factor, second to high cholesterol. And it can be managed. Diabetes can be managed through lifestyle modification, weight reduction, healthy diet, things like that. If you cannot manage it through diet modification, lifestyle modification, there are different medications. Um, if you can avoid them and do the hard work to change your life, that would be the best because diabetes eventually heavily impacts your kidneys, and then that leads to dialysis and kind of not a very pleasant way to experience the end of life. So try to affect all these things through lifestyle modification. Like we said, high cholesterol is a huge risk factor. It's a waxy substance that is in the blood. It's produced by your liver, but is also present in the foods that we eat, especially animal products. So it's found a lot in, very fatty foods, fried foods, um, very fatty cuts of meat. It's found a lot in beef, a little bit less so in pork, but that's also bad. Less so in chicken and far less in fish. So cholesterol is made up of three different types of cholesterol. We're talking about your total cholesterol. You have your HDL, which are your good cholesterol, which helps to reduce your bad cholesterol. The LDL, um, and that's usually what's produced by your liver and found in the different foods. Uh, and then there's triglycerides, which is the fatty component of the cholesterol. So the goal is to have your total cholesterol be less than 200. Um, so sometimes one of those LDLs or the triglycerides could be out of whack, but if your total cholesterol or your ratio is good, the doctors may be okay with that. But the LDL is the one that increases your risk for blocked arteries the most. If an artery leading to the brain is blocked, a stroke can occur. And similarly, if an artery leading to the heart is blocked, then a heart attack can occur. So here's a slide about eating a healthy diet. Try to eat the rainbow. Eat lots of vitamin-rich fruits and vegetables to help maintain your blood pressure and lower cholesterol levels, and it's going to improve your brain function. Diets high in saturated fat, trans fat, and cholesterol can raise your blood cholesterol levels. Diets high in sodium can increase your blood pressure, and high calorie diets can lead to obesity. So it's all kind of a vicious cycle. So it's important to maintain a healthy weight, eat a balanced diet, and lower your salt intake. A big part of that that can help address that is physical activity. So exercise is very important to maintain your body's organs' health. Not only will it help you burn calories and lose weight, it'll also make every part of your body more efficient. So it reduces your risk of stroke, heart disease, helps you lower your weight, reduces your risk for diabetes, and lowers your blood pressure. Physical activity daily can help reduce your risk of stroke and heart disease, blood pressure, cholesterol, blood sugar, and it improves your mood, so it can help affect depression. The AHA recommends 30 minutes of physical activity at least 5 days per week. It doesn't have to be done all at once. You can take a couple of 10-minute walks per day, do some yoga, some stretching. It's very good for you. Ride a bike, take the stairs instead of the elevator. Do whatever you can to make your life more active. Walk more, drive less, if you can. Um, Go to the mall, walk around, park further from the store that you need to go to. Um, those kinds of things. Just work in little activities. You don't need to go to a gym to be active, but if you do have a gym membership, use it. Don't just pay for it and think that you're going to lose weight or affect your health. Lots of people are guilty of that. So make every move count. Just a little infograph of the kind of exercise you should do. 10 minutes of stretching and walking the length of a football field, 2.5 hours of walking each week, 30 minutes of tennis, or walking a 5K, 1 hour of dancing. Dancing counts. Um, Vacuuming or gardening for 20 minutes also helps. It's like walking 1 mile. Grocery shopping helps. 30 minutes of grocery shopping, you're walking, you're moving groceries from your cart, um, lifting things. So there's lots of things that you can do to build in natural exercise. Maintaining a healthy weight is very important, like we're discussing. If you're overweight, take steps to get your body mass index into a healthy range. Excess body weight and obesity are linked with increased risk of high blood pressure, diabetes, heart disease, and stroke. Some recent studies have found a link between being severely underweight and stroke, so it's really important to maintain a healthy, normal weight. And also imagine, the heavier you are, the harder your body has to work to try to um, provide the oxygen and blood flow and nutrients to those various areas of the body. Your organs will be stressed more, your kidneys will be taxed, your liver will have to detoxify a lot more. So it's better to try to maintain a really healthy weight. Um, Smoking again is a very, very big risk factor for strokes. Smoking hardens your blood vessels, narrows them. increases your blood pressure, has a lot of toxins in it. So overall, it's really bad for your heart, it's bad for your brain. So if you do smoke or vape, try to quit. It's pretty bad for you. Atrial fibrillation is a big risk factor that a lot of people have probably heard about. It's an irregular heartbeat and heart rhythm, and it causes the heart's upper chambers to quiver rather than beating in an organized rhythmic way. So on the bottom right-hand corner, you can see the normal blood flow and beating, how the blood flow will go through the chambers of the heart, goes in an organized fashion. In comparison to atrial fibrillation, it kind of goes all over the place. And when that happens, the blood can kind of pool in one of those chambers. And when blood pools, it causes clot formation. And then when the heart pumps again, or maybe pumps at a higher rate, because a lot of folks that have atrial fibrillation experience rapid ventricular rate, which is a very high heart rate, it can kick that blood clot loose, causing a stroke. It can travel to your brain. So it's really important to address AFib if you do have atrial fibrillation. Um, some people live without any symptoms and may not know it. Some have like an elevated heart rate from time to time, and they might feel that. If you do ever have that, you should see your doctor, preferably a cardiologist. They can do a lot of tests like an EKG, put a long-term cardiac monitor on you to pick it up if it comes and goes. Um, you can wear a smartwatch, a Apple Watch or a Samsung watch that can detect AFib. And there's different mobile EKG monitors that you can purchase as well. So it's really important to address AFib. If you do have AFib, you probably will have to be on a blood thinner to prevent that clot formation. There's also procedures like ablations or maze procedures that can kind of change the pathway of where those electrical impulses are going, thus returning your heart rhythm to a normal rhythm. That's a possibility, or there's cardio versions where you're shocked, things like that, to kick you back into a normal rhythm. But all of this has to be discussed with a cardiologist. So if you have AFib or know anyone with AFib that's not addressing it, please make sure that they do. It's a very big risk factor for having a stroke. Carotid artery disease, we kind of mentioned earlier. It's where there's some plaque buildup inside of the carotid arteries in your neck, and those arteries feed your brain. So if those kind of get stenotic or narrowed or stiffened, a lot of those plaques can build up. A clot could get stuck there, or a clot can form there, and that's essentially blocking off the blood flow to that area of the brain. So that in and of its own is causing a stroke. If it does form a clot there and it breaks loose and travels somewhere to the brain, then that's a true stroke there, and that's going to be a bad day. So if you have carotid artery disease, try to address that again, probably with your primary care physician and a cardiologist, and potentially a vascular surgeon. One of the most important things in stroke prevention is adequate hydration. So we're all guilty of not drinking enough water. For a healthy adult, it's recommended about 2 to 3 liters per day. Now that's one of those standard sized Arrowhead or whatever water bottles. That's 500 mLs, one of those regular ones. That's about 4 to 6 of those per day. That's going to help keep your vasculature open, your blood flowing smoothly, less thick, help with perfusion to all of the vital organs in your body, not just your brain. So really try to drink enough water. All fluids count, but caffeine, like coffee, tea, sodas, caffeine is a diuretic, and that will also make you lose fluids. So you kind of have to offset that with more water. Same with alcohol. It can be very dehydrating. It'll make you pee more, and you'll lose your fluid that way. Um, the other thing too is that there's alcohol in beer and um, liquor and things like that. So that can also mess with your brain. Um, but everything in moderation. You also need to enjoy your life. So, not saying you have to stop drinking completely, but the recommendation is two standard drinks for a man per day, one for a woman per day. Just be mindful. If you do drink heavily, that can increase your risk factor for stroke. Also, juices and sodas, they have a lot of sugar in them, so be mindful of that because that can increase your risk for diabetes. So it's really water is the best option. Also, restorative sleep. A lot of us do not get enough sleep. Lots of us are stressed out, um, maybe think too much at nighttime, don't have the best sleep hygiene. It's really important to get adequate restorative sleep. It helps your brain recover, restore itself, rest, all of those things. And if we don't rest our brain, it's just going to be under so much fatigue and it's going to increase our risk for stroke. So it's really, really, really important. So remember, 80% of strokes can be prevented. Control, treat, improve your risk factors. Keep your stroke risk low with regular checkups with your doctor. Treatment for stroke risk factors if you have them. And this is another iteration of the BFAST. This is one that we came up with as a stroke program, and it's a lot of the education that we hand out at different events. So remember, BFAST stands for balance, eyes, face, arm, speech, and time. And call 911 immediately if you or anyone you know is experiencing any of those symptoms. Any questions? I know there's a lot of information.
Yeah, Justin, let me jump in real quick if I can.
Yeah,
I have to start you, but I wanted to tell you, bro, what a great, excellent presentation. And thank you very much.
thank you.
And
Appreciate that.
sure. And then if anybody has questions watching this live on the replay, please put your questions in chat. Either Justin or I will get back in touch with you. But you know what amazes me, bro, is that the prevention.
Hmm.
No, I mean, I really love how you really got into prevention because I think majority of us don't know about that. We can actually turn a stroke, not have a stroke if we prevent it.
Hmm. Hmm.
So
Yeah, it's
really
all
good.
about prevention, really addressing any risk factors that you might have, and then hopefully never have a stroke, you know?
Yeah, I definitely would like to do a podcast with you just where we focus on prevention and really
Hmm.
focus that. But I want, hey, Justin, we're getting down to the end here. Tell me, please, if someone wants to get a hold of you, what is the best way to get a hold of you?
Well, you can reach out to me via email. That's probably the best way to reach me. My email is justin.vechayiem at hoag.org. That would probably be the most reliable way. That way, I have your contact information and I can respond pretty quickly. Otherwise, I'll probably forget also if you just give me your phone number or something because I see so many patients. But if anybody does have any questions or has any needs or wants some advice or anything like that or needs help navigating the healthcare system, I'd be more than happy to help you out. Um, but you can also call me. I can share my phone number with Aaron and he can distribute that to you guys if you guys so wish. So please feel free to reach out to me. Yep, there's my
Yeah,
email right there.
I really appreciate that because I'm going to, all the links I'll put in the description of this video so everybody has a chance to really I wanted to draw attention to something that really kind of got me excited. You hold a once a week stroke club meeting, correct?
Correct. Yeah, we have a stroke support group once a month, every fourth Thursday of the month from 2 to 3:30 p.m. And it's both virtually and in person. So it's via Zoom, but I do send out the flyer for that each month. If you do want to get on the email list for that, please send me an email and I'll add you to that. And then you'll have full access. It has all the link information and everything, really easy to get on there. So try to make it simple and painless for you guys.
Well, I really appreciate that, Just. I mean, the hardest thing as a stroke survivor myself, and I know my brothers and sisters stroke survivors is support. So again, people, I will put in the description of this video. I want you to use this video as a way to promote stroke awareness. So
Yeah,
feel free to share this video, like this video, share with everybody you can, because you may end up saving their life. Justin, thank you so much for taking your time. Really appreciate it.
of course. You're welcome, Aaron. Thank you
All
so
right.
much for connecting with me.
Sure. Well, I hope we can do more in the future. Well, thank you, bro. Sit tight. I'll close out the podcast. Oh, wait. Let's see what it says. Hold on. We're going to beat that
Yeah,
percent. All right.
sounds like furosemide. Yeah, Lasix.
Okay. Yeah, I'll be honest with you. Just I'm cheap. I've been really terrible about water. And I did
Yeah.
realize that it's really critical is make sure you're hydrated.
Yeah, you need to keep those blood vessels open. For this gentleman's question, it is kind of tricky, because if you're on diuretics because maybe you have heart failure, or he's had an ablation and it probably knocked his heart back into a regular rhythm, but then his heart wasn't used to that anymore, so it's still getting used to that rhythm. It can put you into that CHF. So in those cases where you have congestive heart failure, you need to be cautious with the amount of fluid that you have. That's kind of where we talked about the cardiologist and the neurologist needing to be kind of on board with each other to find that balance to make sure that you have enough hydration to support all of your organs, your heart, your brain health, but to also not overload you to where then you're having congestive heart failure symptoms, difficulty breathing, things like that. So, um, yeah, diuretics are kind of tricky in terms
All
of
right.
hydration.
Well, thank you, Justin. I really appreciate that. Uh, if your audience out there, Stroke TV Media, but I hope to bring Justin back on because I'll be in survivor and CEO of Stroke TV Media. It has been an honor to have you, Justin. Appreciate you taking the time for us. Thank you.
Thank you so much.
All
Appreciate
right,
you guys.
stick around. I'll play the outro and stick around the green room. We'll talk.
Sounds good.
Thank you, Justin. Well.